what made you choose Rolling Plains Memorial Hospital?
So my story's a little unique coming to Rolling Plains. I'm from Odessa, Texas originally, and my mom actually put in the phone lines for a department with Texas government, and it happened to be the Department of Rural Affairs, and found out about a program that would pay for your med school if you found a partner in a community. And so being from West Texas, I always wanted to come back here, and so I started calling West Texas hospitals, and Rolling Plains was great enough to partner with me and pay for half of my medical school, and the state of Texas paid half, and I ended up coming here and owing 4 years, and that's been 10 years ago now.
Oh my gosh.
Yeah.
That's brilliant.
Yeah, so it worked really well, and I'm glad I ended up right where I'm at.
Wow.
So are we.
Yeah, I bet. So I actually had heard about this kind of thing from, there's this thing called Becker Healthcare, and Scott Becker and I were talking, and he said that these used to be the programs.
This is what gets doctors to stay. Dr. Aker is in the same boat, and he's 16 years in now.
Oh my gosh. Wow. So you get here and you stick.
Yeah, well, once you've paid off your 4 years, you've built a family and a life here, and you've built your patient practice, and you're like, okay, this is home. This is where I want to be. And being from West Texas, I already knew I wanted to be out this direction anyway.
Yeah.
Closer to family.
Yeah. That's awesome. I love that right out of the gate. So this is kind of not even applicable to you. I was going to ask, how often have you moved hospitals during your career? But it sounds like
came straight out of residency and.
That's great. Okay, so, getting back into the sort of practice, what are some of the risks of delivering in a rural hospital versus others like metro or more regional hospitals?
Yeah, so delivering rural, you get a little difference in not so much the care provided, but some of the resources at your fingertips. And so we get around a lot of that by using different members of our care team. So in a big hospital, you might deliver, and if you're a high-risk delivery, you may have the NICU team in your room. Well, here we don't have a NICU team, and so we bring in an extra doctor who's for mom or for baby, and we have one on each place. Plus we have respiratory therapy come in, and they help stabilize if we need it. We also may have an extra nurse come in and have kind of all hands on deck and facilitate what would look like a NICU team in a big hospital, but in our hospital, it looks just a little bit different. We also don't have some of the specialties involved, but the nice thing is we use telemedicine a lot, or even pick up the cell phone and call our constituents in the bigger hospitals and say, hey, look, we have this kind of thing that's not, it may be normal, it may not be, but we want to pick up the phone and call you and say, hey, here's what I've got, and run it past them. And we have those connections in several of the surrounding communities that make it really a lot better than us just being out here standing alone saying, well, sorry, I don't know, and you're stuck here.
Right, yeah. Let's say we were just talking about this concept. We call it who, not how. So if you know a lot of who's that know how, right, it's like you just connect with them.
Exactly,
yeah.
Exactly.
Yeah, so for me, my daughter's a labor and delivery nurse, but yet, I don't know what the OBGYN profession is. And maybe for the folks that don't have a real clear understanding, what is it that you do in your world from the time that somebody's pregnant? Is that when it starts the care, or does it go well before that, I'm sure? It's do you mind kind of giving an overview?
You bet. Okay. So in an ideal world, I am family medicine, and I would love to take care of people from the time they were born all the way to preconception. So they're thinking about having a baby and get that kind of their health maximized at that point. And then once they have the baby, take care of them during their pregnancy. And then, of course, be there for the delivery, because that's the fun part.
Yeah.
And so ideally, that's what we would love to see. And then, of course, take care of mom and baby afterwards. That's why one of the reasons I went into family medicine is because my mentors are a pediatrician and an obstetrician in medical school, and they both wanted me to go their direction. And they said, why family? And I said, well, because it's the only specialty you can deliver a baby and take care of it too. And I hate the idea of having to give off a patient, because, I've bonded with them. I'm ready. I want to be there. They're part of my family, part of, what makes my world click.
Wow. That's awesome. We were talking about that earlier. How does passion sort of play into, a good doctor versus, maybe somebody that doesn't have the passion, I guess?
Sure. Yeah. Having a passion for not only what you do, but also the calling that you're put forth. I mean, it really makes a world of difference. It makes those 3 a.m. phone calls for delivery not, I gotta get up and go to work again. It's, oh, good, I get to get up and go be with my friend who's delivering now, and I'm ready to see this baby. Does it have red hair? Does it have black hair? Who knows? And so that's part of what drives those long hours sometimes, is the passion, knowing you're helping people and you're there for the ones you care about.
Yeah. TJ just said that actually, exactly verbatim. She's going to be the one that likes to get up at 2 a.m. and has a passion.
I didn't say like, to be fair.
Okay, yeah, you're right.
No,
But I
don't
did
mind
say
it.
that, yes, you were one that's going to do that, that you are the passionate one that is not going to complain about the 2 o'clock phone call because
They need
you
to
want to be
know
here for your
something.
babies.
Exactly.
So I asked the other side of this, but there's the spectrum, and on this side of the spectrum, what's really an advantage or a cool part about having a baby out here in rural America?
You bet. So I've delivered one of my babies in a huge hospital, and I was via C-section, and I had a lot of health problems going on. I didn't see my baby for 3 hours. She was whisked away, and I didn't get to catch up with her. And I delivered my other 2 here at Rolling Plains. And the care is just phenomenal. You get nurses who, it's not a post-delivery nurse, it's not a nursery nurse, it's not a during delivery nurse. You know, in the big hospitals, that's how they work because you have to transition floors, and it's not. Here, you're in the same room for your entire delivery. You come in, you meet your nurse, and the only time then the nurses change is if it's shift change. And so you really get to know them. You get one-on-one care. There's not 11 deliveries happening on the floor at the same time. So you actually get nurses who aren't rushing around trying to get everything done. It's just a more personal care that you receive. I tell people all the time I would deliver hands again in a rural facility over a large facility just because of the one-on-one care I got.
Wow.
And I have people that come from quite a bit of surrounding areas, including the big towns, because they don't want to deliver at the big hospitals because they get lost.
I've heard that too. We were just talking about that. The parking is easy. Finding your way to where you need to go, telling loved ones where to go, all that stuff matters.
Exactly, it does. It matters a lot. And like I said, it just big hospitals don't have that luxury. But that's one of the cool things about delivering in a smaller hospital is we have the luxury to do more personalized care because we're not as busy.
Yeah, it does. It kind of sounds boutique. You get to, sort of have that experience. And I put it beautifully. I love the way you said that.
And I have a nephew and niece that were delivered by not only Dr. Liedtke, but also by the same nurses.
Yeah.
So, I mean, it's just like boutique. I think that's a great way to put it, that, Chelsea Miller has been a part of both my niece and nephew being delivered, as well as Dr. Liedtke.
Nice.
She has.
Yeah. My daughter was born in an actual boutique type, labor and delivery place in Oklahoma City. And, I loved it. I loved it. Everybody was just what you described. It's exactly the experience that I had, And we were low risk. I mean, we knew, young, healthy, all that
Right,
stuff.
and I was gonna say, sometimes you need those big hospitals. Sometimes you need those interventions that we can't offer here. I just had to transfer out a patient for a placenta accreta, which where the placenta grows into the uterus. I can't take care of that here. We don't have the right staff. We don't have that. And so knowing your limitations is really important going forward. So she's now going to deliver down the road, and it's going to be the appropriate place for her to go because we don't need to be doing that here.
Sure. Yeah. So ego goes out the door, right? You just, whatever best, right?
Well, sometimes what's best for our community is sending them down the road. I mean, and I think that's important for us to know as well.
Yeah, for sure. What, speaking of cases, are there any cases that stick out to you that you've had, experiences that just come to mind when you think about either they were hard or they were beautiful? Is there anything that just rushes to your brain?
Well, I don't know. Working here, as TJ said, we are a big family, and I get really involved and really get to learn the nurses, especially back there in labor and delivery because we're with them all the time. And so I've had the pleasure of delivering I was trying to think, I can't think of the number, but for quite a few of those nurses back there, and not just 1 or 2 babies. I'm actually just delivered the 3rd baby for one of them. And it's just, it kind of perpetuates that passion, that sense of family. I really, they're not my kids, but I see them at softball and I see them playing and, they know my kids. And it's just brings home that heartwarming feel this is why I practice here. This is what community medicine means.
Interesting.
Well, they're one of our own. I mean, you're delivering one of our own. Absolutely.
Exactly. It's just, and it's really cool. And yesterday I saw a young lady just for a checkup appointment. She's 9. She was my first delivery in Sweetwater. And we actually were talking about that. The mom was set to deliver in Abilene, and she got here and she was too far dilated to go. And she was mad because the new doctor was going to be delivering her baby. And so in October, of 2014, I guess, I walked into the room and she was mad and almost threatened to leave against medical advice. And now I take care of her entire family, including the baby. And she said it was just God's work of you coming in the room and just taking control, and it was an easy delivery. And like I said, I love when I get to see her because it reminds me of all of my time here.
That's great. It's fate. Yeah. So I think about, like, you just described something that's very intimate, and it's hard to put into words, what that probably feels like and what you're striving for. Like when you say, oh, that's fulfilling. I hear fulfillment, right? Is what's really kind of the beautiful thing, is that it just goes deeper and deeper and deeper, it sounds like.
Right. That relationship just continues to grow.
Yeah.
I don't have to turn them over to some specialist down the road, then I never get to see or hear from them again. They're mine, and they mean a lot to me.
Yeah.
The reason I stay.
That's amazing. That's what the interviews we've done of the people who have worked here, they all have that sort of thing where they take ownership. You have somebody looking out for the patient, and we've heard that in every interview. Like they feel like they're the one that should be looking out for the patient, whether they're the nurse or the director or whatever. And you're saying the same thing. I don't know. It's pretty amazing. And this isn't a commercial for Rolling Plains. This is just a regular interview, but we hear this all the time here. So I wanted to point that out. So like when do doctors sort of generally like understand what they want to specialize in? Does that come through like in medical school, or at what point in your life?
I'm giggling because if you had asked me when I was in high school and college, I was going to be a pediatric neurosurgeon. I had no idea really what that entailed, but that was what I felt like I was going to do. I wanted to be around kids, and I really wanted to help them. And I sat through my first pediatric neurosurgery case actually about a month before I went into medical school. I got a chance to shadow a doctor, and I came out of there and said, this is no way what I will ever do with my life. It was a 12-hour case, and you had to sit there and focus that whole time on one thing. And I thought, I could never do this. And so then I thought, well, I'm going to go into pediatrics. I love kids. They're just where I feel called to minister to. And I thought, obviously, I'm going to go into pediatrics. And I happened to be working with a doctor. His name was Dr. McNew. I went to Texas A&M's medical school. Everyone there knew Dr. McNew. He actually passed away about a month ago. And so he had this free clinic, and he would let you come volunteer. And so I thought, well, I'm just going to go volunteer with Dr. McNew. Everybody talks about how great he is. And so I went and I volunteered there. Well, I thought it was a pediatric family clinic. Turned out it was a pregnancy clinic. I didn't even know walking in the door. And I walked in, I hadn't been there 10 minutes, and he said, come on, let's go. And we went and we delivered a baby. I'd never seen a baby delivered before in my life. I was kind of a little overwhelmed. He used forceps, which a lot of doctors these days don't use much anymore. And so you just reached in there and grabbed and pulled that baby out, and mom was happy, he was happy. And I just thought, well, cool, let's like pull some more babies out. And so ever since then, I've had not only the passion for kids, but like just mom care. And so really women and children are the thing that just lights my fire.
Oh, that's great. Yeah, it's funny. My daughter's the same way. That's awesome. So how do you know, we were talking about this earlier, how do you know that you have a really good OB department? Like what are the measurables that make a department excellent?
Sure. So I think there's several. One is the staff. And staff turnover, we have had nurses who have been here a very long time. What's really nice about that is the providers get to learn them, they learn us and know our preferences. And so there's a lot of times when someone can call me and be like, I need you here now. And even in the tone of her voice, I'm like, yes, ma'am, I'm on my way. Versus if you don't know that person, you're like, what, are you sure you really need me to get up at 4 o'clock in the morning to come in? Yeah. But no, like once you establish that relationship with them, it means the world when you can trust what they're telling you.
Yeah.
Not only that, we have top, high quality. When I started here, we did not have the OB department we have today. I delivered my second child in a OR that looked like a closet. And then we stayed in a hospital room that was fairly old and kind of dilapidated. And I came here under the promise that they were going to be building the new OB unit, and they did, and it's fantastic. We got to come in and tell them what we wanted and help. We have a new OR back there. We have a nursery. We have warmers in all the rooms. Used to, we only had one warmer. We pushed it to all the rooms. Yeah. And so I think that the facilities say a lot about a place, and the pride in the facilities. So we keep them clean. We keep them well stocked, and just also the amount of, I'm trying to figure out how to say it. So there's lots of different birthing techniques, and some of the hospitals get cornered into everybody needs an epidural and to deliver on their back. And in this day and age, not every mama wants that. And I think it's important to recognize what women want and be open to that. And I think we do a very good job of that here. We have now intermittent fetal monitoring. We have wireless monitors so they can get up and walk. The OB ladies redid the entire courtyard so that our mamas could go walk out there so they didn't even have to stay inside the whole time. We're working on trying to see if we can get one birthing tub put in. They're very expensive, and so that's a budgetary thing that we're working on. We're also working on trying to get a NOS system, which is a different type of pain control that a lot of mamas are really liking now. So the epidurals and IV pain meds aren't your only option. And we have birthing balls and rocking chairs and squatting bars. And so lots of things that our nurses know about and are open to and not so closed-minded. And I think that's really important in delivering because you don't get that everywhere.
Sure. Yeah, I think it's hard to measure that kind of stuff, but it's certainly, once you see it, you know it, right?
Right.
So along those lines, what are some of the advances, technological advances that are coming that you're excited about? May not be applicable to your field, but it's like with AI, it's so much talk about that. Is there anything that's out there that you're like, oh, that sounds cool?
Well, I don't know.
Yeah.
I mean, we've now got I'm trying to remember. So used to stop postpartum hemorrhage, we'd use a Bacre balloon. They're very effective, but they're kind of hard to place. They're very uncomfortable for patients. And now we have the Jada system, which is pretty new to our unit. We've had it about 6 or 7 months now. And it's actually kind of the newest off the market. And it is fantastic. Works instead of through pressure that the Bacre works through, it actually works through suction. So you hook it up to suction and it pulls everything down. And so I was very excited when we were able to get those at this hospital.
Oh, okay, cool. Okay, so it's applicable in some ways. Okay. Yeah, I just, from that perspective too, like when you think about advancements and going into the future, like where do you kind of see your OB department being? You see growth, it seems like on the horizon, what does that sort of mean for you? And excited about that?
Well, of course.
Yeah.
So we, as far as the OB department, we're constantly striving to be the best. We want to be excellent.
Yeah.
We don't want somebody to say, oh, I don't want to go there because they don't provide the same care I can receive at a bigger hospital. Yeah. So we're part of the AIM initiatives, which is Texas-wide. It's moving like different standards that you have to meet in order to provide the same care. We also report quality improvement back to the state on all of those measures. So we do postpartum hemorrhage, we do maternal screening for depression is actually on there. Nice. And then we're also baby-friendly Texas 10 Steps Hospital, and we maintain that certification. We actually have people that have almost completed their lactation consultant license, and they're going to start coming through. So our nurses are all breastfeeding trained, but now we're going to have actually certified consultants that can come through, which is one area that we found that we really needed some help in.
We're hoping in August. We're hoping by August.
Yep. And so cool. we said, hey, this is an area of need because that's what you do. You constantly say, where can we get better? And you find that and you fix it and you go forward. And so we found that was an area that our mamas thought was important. And so we're going to go. We're actually working on trying to restart our OB education. We were doing that up until COVID, but then we had to drop it because you couldn't be in big groups. And so now we're trying to actually get that back online as well so that we can provide the community with education.
And we also have a pelvic floor therapist as well that's getting certified and all this stuff. So,
and she's wonderful.
Yep, lots of stuff.
Mm-hmm.
Nice. That's kind of a change in the topic. Like, how do you like to be led by hospital executives? What's the style that you appreciate the most?
Honestly, I appreciate them just sitting down and saying, hey, this is what we're thinking about. What are your thoughts?
Yeah,
and
being curious.
Yeah, and that's one of the nice things about working here, at a small hospital is, Doug's office door is open most of the time. And if I have an issue, I just walk in and say, Doug, hey, this is what's going on.
Yeah.
Have you been aware? What are we doing to fix it? Or if he's not aware, then tell him what's going on. And if I have thoughts about how to fix it, or maybe we need to get a council together, or, I'm not sure. But it's just nice. You don't have to go through the bureaucracy of people, one after another, and they're like, oh, that's just some little doctor who, nobody else seems to have that problem. We're not going to worry about it.
Right. Yeah, that's really impressive, actually. The way that decisions are made, it sounds like, are really kind of without politics. They listen, which is a pretty good quality to have. So.
Oh yeah, for sure.
Yeah, and then it sounds like you get to be autonomous and you get to do your thing, right? Okay.
You bet.
Yeah. Now this is a weird one. There's this popular topic in the news, and it's pretty recent. Ozempic babies. Have you heard about that?
Sure.
Yeah. What were your thoughts on that?
Yeah, so it actually is not so much, they've coined the term Ozempic babies, but it's weight loss babies.
Yeah.
So, we've seen this phenomenon in people with weight loss surgery for forever. In fact, you have to tell them, hey, when you start losing weight, your fertility, your hormone levels start to change, and it's actually you're more fertile. And so with all this weight loss and people getting healthier, which is great, that's what's leading to people who may have been anovulatory or had dysfunctional ovulation becoming regular, because weight does really play a large part in that.
Sure.
And so it's a very real phenomenon.
Oh my gosh. Yeah, I was just thinking it's because they felt like they were hotter or something like that.
Yeah, no.
Are there more or less babies or fewer babies being born now to like compared to, I don't know, early 2000s or the last of the 20th century? Can you tell a difference?
Sure. My practice seems busier,
Yeah.
but I really can't. I mean, I think our numbers here at the hospital they've gone up some. I think that we see a flux when we get new providers.
Yeah.
And then if we lose a provider, which over the last 10 years we've come and gone some, that we see that kind of ebb and flow with them. And so I think having more providers here, that's always not the solution, because sometimes having too many can be a problem, but we haven't got to that point where,
Yeah.
where we feel like that's an
Yeah.
issue.
Yeah.
So,
Oh, no, it was
but-
just a question about your
yeah,
your
but
perspective.
like I said, my practice has gotten busier and busier,
Wow.
which is great.
Yeah, that is great. That is great. Well, cool. Anything else? Anything like about you that, when the patients come in that it's important that they know about you. You just want to kind of,
I think when I look at my obstetric care and what really motivates the way I practice is I really just want each mama to come in, and a lot of them come in with preconceived notions, bad prior deliveries. They didn't have the birthing experience they wanted. And coming from my background of not having had what I wanted, I was preeclamptic, I was on MAG, I pretty much got told either we go have a C-section or you are probably going to have a seizure, and then my baby got taken away. I didn't get to do skin to skin. I really feel like that's what drives me to say, hey, what went wrong last time? What do you think is going to go wrong? What are you worried about? And how can we make sure that I do my best? I can't always promise you the birth that you exactly dreamed of, but how can we work together to make it a dream birth where you feel like you were heard, listened to, and that you got exactly the experience that you were hoping for.
sounds fair. That's awesome. Okay. Thank you very much. Great job.